Hello everyone and welcome. My name is Dr. Matt Reddy and this is my April 2014 video blog. In my practice, one of the things I work with a lot is menstrual irregularities in women. And menstrual irregularities can show up in a lot of different ways. It can look like absence of a menstrual cycle. It can look like irregular periods. And in many cases, it looks like very painful periods and heavy periods. And sometimes it's a combination of all of these things. And unfortunately, most women only know of a few options to treat these irregularities. And that is the birth control pill, and in more extreme cases, surgical procedures. Now, the naturopathic medicine, however, has been extremely effective at supporting and managing these types of cases. And so I've been asked to share a little bit about my approach because I want we need to get it out there what more there are other options, and that there are things that can be done besides medication and surgery. So that's what I want to do today. And so I'm going to start off just letting you know about three different things. There's three areas that I look at primarily when I look at menstrual irregularities with women. And you need to keep in mind, however, that there are lots and lots of differences between patients. And so what works for one person isn't going to work for the next. But there are some common threads. And that's what I'm going to look at today, are these sort of common threads that I've seen over the years working with these types of issues. So the first thing that I always address when I work with menstrual issues is the diet. Now, of course, that's a common thread with all naturopathic approaches for any kind of health issue. But I see it really clearly with menstrual issues. And I'm talking about dietary things like eating too much sugar, not having enough vegetables, not having enough protein, drinking too much alcohol, maybe having a gluten sensitivity or celiac type presentation. All of those really put a lot of stress on the body and prevent the body really from healing. And anytime you've got a poor diet, you really don't have a good foundation for health. And the more stress the body's under, generally the more irregular periods are. So the second thing then that I address, and those of you who have worked with me before will probably smile at this because this is something that I work with a lot, and this is working with liver function. Now you may be saying, what do you mean liver function? Aren't we talking about hormones here? Well, yes, we are talking about hormones, and hormones in the liver are very closely related. Now the liver's job, one of its many jobs, is to eliminate your hormones. So your body makes the hormones, they work in the system, they do their job, and then you have to get rid of them. And that's the job of the liver. It's specifically the job of the bile. So one of the things that liver makes is the bile. And you actually make a liter of bile every single day. And the hormones that are used up get put into that bile, and then you can excrete it. But we don't do that very well. We don't make bile well. And as a result, then, hormones are not eliminated correctly. And if we don't eliminate the hormones, they get out of balance because they build up too high. So we have to get the liver working well. And that has been one of the core pieces of getting the hormones balanced, and it works extremely well. So to do that, I use my basics, and those are 4 supplements: taurine, lecithin, cod liver oil, and then Treonate. And you can read more about those here on my website. There's actually a little button here called My Basics, and you can click on that and read more about those if you'd like. But once those are in place, we have a much better chance of getting all the hormones balanced. And then the last thing that I look at is going to be actual hormone levels. And specifically, one hormone that I look a lot at is progesterone levels. Now, progesterone is only one of the hormones involved. You've also got estrogen. You've also got the hormones from the pituitary gland. You've got hormones indirectly related with your thyroid and with your adrenal gland. So there's a lot of other hormones involved, and we often need to do assessments and maybe lab tests to assess those. But in general, what I found is that there are low levels or lower levels of progesterone than there should be. And by simply adding a little bit of extra progesterone, if it's needed, really makes a big difference and reduces a lot of the PMS type symptoms, really strengthens the regularity of the cycle. So those are my 3 approaches. Like I said, every patient is different, so we would have to assess all the individual needs that each person would have. But it really does work, and people don't need to be on the birth control pills for the rest of their life. They don't need to have surgeries, and they don't need to be on pain pills or anything else, for a few days during every month. There's a lot of things that you can do. So hope this was helpful. If you'd like me to do some assessments for you, please let me know. If you have a friend or anyone else that could benefit from this, please pass it along. I would appreciate it, and I look forward to hearing from you soon. Thanks.